Now let's continue taking a look at the microscopic anatomy of bone. We're going to start with compact bone. Another name for compact bone is lamellar bone, and it consists of osteons, canals, canaliculi, and different types of lamellae. When we talk about lamellae, there is the concentric lamellae of osteons. There's also circumferential lamellae that go around long bones, and interstitial lamellae that are leftovers from bone remodeling. But let's start with the osteon and its concentric lamellae. Another name for the osteon is the Haversian system, and an osteon is known as the structural and functional unit of compact bone. It consists of multiple elongated cylinders, and they run parallel to the long axis of bone, especially when we're talking about the bone that we see in long bone. Compact bone tends to be more on the outside of bone, and that's where we find osteons. An osteon is really just multiple cylinders, several rings that are around each other, so concentric rings, and those rings are called lamellae. They contain collagen fibers that run in different directions in the adjacent rings, and this allows bone to withstand stress and resist twisting. And bone salts, of course, are also found in this bone matrix to make it hard and allow it to resist compression, and they are found between collagen fibers. So lamellae are just matrix tubes. For an osteon, they look like rings on a tree from a superior view, or if you're looking at the rings at the top. They're often seen around that central canal of an osteon, but there are different types. There's not just concentric lamellae surrounding the central canal. There's circumferential lamellae around the diaphysis or shaft of a long bone, and interstitial lamellae that are left over from a bone remodeling. So they're found in between intact osteons. So here's a view of concentric lamellae. Here we see 3 rings, and if they were all evened out, you can imagine how they would look from a superior view, kind of like tree rings. We can also see the collagen fibers that run opposite to each other in adjacent rings. Each one of these rings is lamellae because they're just around each other. We start with a small, then a slightly bigger, and a little bit bigger as far as the ring structures are concerned. These rings are called concentric rings or concentric lamellae. We also can see the central canal, sometimes called the Haversian canal, and it has blood vessels and nerve fibers and can have lymphatic fibers. So unlike cartilage, bone is vascularized. It has blood vessels. It's also innervated. It has nerve fibers. Here's a side view for an osteon. We're seeing just a portion of it, but you can better see the nerve, the vein, and the artery in that central canal. You can also see the osteocytes sitting in cup-like structures called lacunae in between the different lamellae. These lamellae of the osteon are concentric lamellae. But interstitial lamellae and circumferential lamellae do exist. Interstitial lamellae are not a part of the osteon. They do fill gaps between forming osteons, and they're the remnants of bone remodeling. Circumferential lamellae are just deep to the periosteum, and they're superficial to the endosteum, and they're layers of lamellae that go around the entire shaft surface of a long bone. That shaft surface is called the diaphysis. So that's going to help long bone resist twisting. Here in this image, we can see the interstitial lamellae. They are in between the circled intact osteons. The intact osteons are also known as Haversian systems, and we can see one in the upper right that has a central canal, and this is a superior view, so you can finally see that rings on a tree appearance. You can also see the tiny little stripes going towards the central canal, but coming off of those lacunae that hold osteocytes. Those tiny canals are called canaliculi, and they allow those osteocytes to communicate with osteoblasts and osteoclasts and the central canal. Here is the circumferential lamellae. We're looking at a segment of the diaphysis of a long bone, but this would continue around the entire shaft of the long bone. So it would go around the circumference of a long bone, hence the name circumferential lamellae. So we have these canals and canaliculi on top of having different types of lamellae. The central or Haversian canal you've kind of gotten to see already. It runs through the core of an osteon, contains blood vessels and nerve fibers. But what about the other canals, like canaliculi or the perforating Volkmann's canals? Perforating or Volkmann's canals are canals that are lined with endosteum that occur at right angles to the central canal. It essentially connects blood vessels and nerves of the periosteum to the medullary cavity and central canals of osteons. Here we can see a yellow arrow labeling a Volkmann's canal, connecting the blood and the nerve supply in the periosteum to those in the osteons. It also continues on to that medullary canal. There's also canaliculi, which are hair-like canals that I've pointed out before, but here we have their definition. They connect lacunae to each other and to the central canal. Lacunae are small cavities that contain osteocytes, and we use the canaliculi to allow osteocytes that are trapped in their lacunae to communicate with osteoblasts and osteoclasts. So osteoblasts that secrete bone matrix are able to maintain contact with each other and with osteocytes. That's because osteocytes have cell projections that go off into the canaliculi and connect to other cells with gap junctions. So even though when the matrix hardened, the osteocytes were trapped, the canaliculi then formed and continue communication between all bone cells. So that allows things like the permittance of nutrients and waste to be relayed from one cell to another. It allows osteoblasts to get communication about what's happening to the matrix, any stressors or strains that are going on in its environment. Here's a better look at not only the osteocyte, but it's sitting in its lacuna and how it has projections that go off into the canaliculi, because the canaliculi are allowing those osteocytes to exchange nutrients and waste and respond to chemical signals, and using gap junctions to do so, our communicating junction. But what about spongy bone? Bone is not just compact, there's also spongy bone, which does appear more poorly organized than compact bone, but it is actually organized along lines of stress to really help the bone resist compression and resist that stress. The trabeculae have curved shapes, kind of like the cables on suspension bridges. So they're able to give quite a lot of strength to bone. But spongy bone does not have any osteons. They're not present. Instead, we have trabeculae or spicules, these kind of irregularly arranged points and lamellae, but there are also osteocytes that are still interconnected by canaliculi. So it has a communicating structure that supports bone communication. There's also plenty of capillaries in the endosteum that supply nutrients to these spongy bone osteocytes. When it comes to the location of spongy bone, for flat bones, it's located between compact bone, and it's just going to fill that internal part of a flat bone. Here we can see the trabeculae, or kind of the points or spicules, and the general shape of spongy bone. We can also find the trabeculae in long bones. You find it around the medullary cavity, and then you also find it at the ends of long bones, or in the epiphyses. We also note that trabeculae has quite a large capillary supply, and in certain structures like the ends of long bones or the epiphyses, it's able to store what we call red marrow, which is the location of all blood cell generation. Here is a picture of a long bone. You can see on the outside of the shaft of this long bone is the circumferential lamellae. Just deep to that, closer to the spongy bone near the medullary canal, are the osteons or Haversian systems. Each one of those Haversian systems has a central canal. So the general structure of a long bone is compact bone on the outside, spongy bone in the center. And there's a lot of vascularization. Not only do we have blood vessels in the central canal, but they are able to make it to the center or medullary space through using perforating or Volkmann's canals. We can also see the periosteal blood vessels in the periosteum that are going to penetrate the outer circumferential lamellae or compact bone in order to utilize those Volkmann's canals and get nutrition all throughout the bone. The periosteum is also connected on the outside of compact bone by perforating Sharpey's fibers, and we can see that in these images. Other things we can't see here are the ends of the long bone. The ends of the long bone are going to have a compact bone matrix on the outside, but they're mainly filled with spongy bone. And those would be areas where we would expect to see possibly hematopoietic tissue or red marrow. All right, our next topic is going to be bone development. So now that we've looked at the basic structure of bone, compact and spongy bone, and kind of where things are located, we're going to be able to move on and talk about how bone actually develops, how ossification or osteogenesis, the process of bone tissue formation, occurs.